Hi, everyone. So I'm Maddie and this is Samantha, and we are doing our project on the environmental and genetic factors of anxiety.
Okay, so a little bit about the background of anxiety. The DSM-5 diagnoses anxiety as excessive worrying that lasts more than 6 months, and it happens more often than it doesn't. So, for example, in a 6-month period, you would have anxiety for 4 out of the 6 months. It can be broken up depending on what days you have it. Within anxiety, there are multiple different types of anxiety. Those include general anxiety, panic disorders, and phobias. I've included a picture of a spider to show arachnophobia, which is just the fear of spiders. Anxiety is an important topic because it is the most prevalent mental health illness, and about 29% of the population will suffer from anxiety at one point during their lifetime. The high prevalence is part of the reason why it's so important to understand the underlying causes, and hopefully will help to better treatment, diagnosis, and outcomes of people with this disorder. So with all of this background in mind, the question we're trying to answer is if environmental or genetic factors are more influential on the development of anxiety, or if both play an equally essential role.
So in our literature review, we split it up kind of for one studies that focused more on environmental aspects and studies that focused more on genetic. So there are many different subsections of anxiety, as Samantha had mentioned, and they do vary on the amount of genetic and environmental effects they have. However, all of them have both. So in Ellie et al., they found, like, for separation anxiety, that shared environmental factors were highly influential. For obsessive compulsive behavior, the genetics represented 2/3 of the variance, and in shyness, 1/3 of the effect is due to non-shared environmental factors. So another study that focused more on the environmental effects was one that focused on how the environment and anxiety like coexist. So a lot of times, that the environment affects anxiety, but they wanted to look at how anxiety affects the people around them. So they did an adopted families study, and it's looked at how anxious children caused anxious symptoms in their moms, but not their fathers. And on the other hand, they found that anxious fathers could impact the symptoms of the children, but the mothers had no effect on the symptoms of the children. And so this was really interesting because since they were adopted, like there's no genetic component involved, but that they still found that like the children could impact the moms and like the fathers for the children. So like they show that this is very important because the environment does play a really big role. And they think that this for the children affecting the moms is because the moms are usually the ones to like raise the children more, and they'd be more impacted. Like if your child's always super anxious, that could like affect how you feel and like how you want to help the child, but like if they're that anxious, and they're not quite sure why that the fathers impacted the children more than the mothers, but it just shows like how where a child lives, like how much that could actually impact their anxiety. So there is also a lot of studies that looked at the genetic impact. One study looked by Boomsma looked at the genetic factors in anxiety for children, and they looked at children from 3 to about 12 years old, and they found that in the beginning there's a high genetic influence of about 76%, but as the child aged, that decreased till about 48%. And as the genetic impact decreased, the environmental impact increased. So for older children, the environment plays a bigger role. And then also in 2020, there's the largest genome-wide association study performed thus far, and they found that there are 6 significant associations. And so they found by finding these significant differences, it shows that there is a genetic difference between like people with and without anxiety. So that's very good for the genetic aspects of the anxiety. And so both of these studies just kind of show that like, yes, there is the genetic impact, but even with the Boomsma one, that there's still an environmental impact, and like the environmental impact increases. So you do have to take both into account.
Okay, so as Maddie explained, both environmental and genetic factors have a great impact on the development of anxiety, but it was found in multiple studies that non-shared environmental factors have the most impact on the development of anxiety. So this can be, for example, if you have two siblings within the same family and one gets bullied at school versus one doesn't, the one getting bullied at school might develop anxiety because of those environmental factors that the other sibling doesn't have. And those siblings will have similar genetics. So that just shows the importance of the environment that the children or adults are in. These findings are important because the better people understand the disease and where it comes from, the better people are able to treat symptoms they see and maybe underlying factors that may lead to prevention, knowing what causes anxiety. So just overall knowing the disease better is beneficial to everyone. It is beneficial so that the family members of the people with anxiety can learn how to more take care of the people they love with anxiety and give them an environment that doesn't trigger their anxiety, hopefully. And it also can help with what medications to be on, if therapy is better, if some self-help classes are better. And so the wide variety of treatment is a result of being able to study the disease. So research is always evolving, and some future studies that we thought might be useful is a very long longitudinal study that spans the participant's lifetime, just because a lot of the studies of anxiety are done in kids and young adults, but don't really follow into the elderly population. And we just want to see like how their life outcome is and how their anxiety is throughout their lifetime. If there's certain spots in their life where anxiety is peaked, so maybe for everyone, late 20s is where anxiety peaks, and we can see what factors in late 20s makes anxiety heighten and how to help younger people with anxiety cope and prepare for maybe their late 20s and lead to less debilitating anxiety. And then another future direction that could be looked at is to compare first world countries and third world countries and see how anxiety affects both of them, and see the different environmental factors that are within those countries and see if there's any similarities or differences. This can give great insight onto, how to address anxiety in different countries, because there are a lot of outreach programs from first world countries going to help third world countries. And if you're using the same techniques you use on people that come from a first world country, the third world country may not be able to relate. So just taking these factors into mind can help with treatment and outreach. Thank you for listening to our presentation.